We have a tremendous amount of electronics, and we depend on those electronics.
Probably the most impressive is the high definition.
The clarity of the pictures is just phenomenal.
I don't think I would ever use a standard definition system again.
Texas Institute for Surgery was founded by a group of physicians and joint ventured with a community hospital, Presbyterian Hospital of Dallas. And that combination is what makes it unique.
We built it for patient care. We tried to make it with the patient's interest in mind, to where they would have surgery and essentially go home thinking that was a pleasurable experience.
This facility was built to be efficient. It's a center with 9 ORs that will run 10,000 cases through in a year, which is a really high volume.
We have one floor where we do surgical cases, so the patients are able to enter on one floor, go to pre-op, go to surgery, go to PACU, and be discharged all in the same area. So we get a great deal of efficiency by that.
For me to do the same number of cases in less hours is more efficient on my time. It's also more efficient on the patients and the nursing staff. And it's just a streamlined approach to medicine.
Our turnover rate here is close to zero. The surgical staff is very happy here, and when you have happy colleagues, things run efficiently, everyone's happy, and patients benefit from that. We have a highly skilled set of RNs that run the inpatient stay. You can see the design of the rooms, they're spacious. I kind of use the analogy, it's like staying at a boutique hotel. You get the best service, you're getting the highest quality products. It's quite a pleasant experience.
With Texas Institute for Surgery, we were able to bring the guys who we think are the top in the field, whether it's orthopedics, ear, nose, and throat, plastic surgery, urology, together in one facility, multiple ORs, have the state-of-the-art equipment, and be able to provide excellent patient care by doing that.
One of the missions of TIS is to be innovative and provide high quality, and the only way you can do that is to stay on top of technology.
Our operating rooms have just been converted to new high definition systems with wireless capabilities, which makes life much easier.
This will be the first wireless HD surgical suite in the DFW area, and as a result we're going to decrease our OR setup times, as we don't have to worry about wires and cables and making sure these are sterile.
I think too that just the ease of use, it's just very easy to look at it and know what you're supposed to do and follow the prompts. There really is not a lot of guesswork to what it takes to operate it.
I personally was able to use the new Stryker high definition suites, and was amazed at the amount of clarity and color resolution that these screens give.
It's been exciting just because we've all been able to go in and watch the new pictures and go, wow, what a great picture that is.
The pictures that I'm able to show my patients and the patient's family, it's pretty remarkable. Now the anatomy becomes really clear to them. They can see what I'm looking at.
In addition, some of the OR suites are set up with observation rooms, which allow for teaching, residents, fellows, physical therapy, and other ancillary medical staff, as opposed to sitting in a corner. They're actually able to watch on video screens what exactly is happening at the time of surgery.
And from a teaching perspective, I give lectures, to residents and to other physicians, and be able to use that image quality in my presentations makes me a better presenter.
Well, with the LED lighting on the new equipment, it makes life much more tolerable. We actually turn down the lighting on these cameras as opposed to cranking them all the way up. With the LED lighting, we don't have to worry about the equipment degrading as the bulbs get worse and worse as time goes on. The ability to see more peripherally as opposed to exactly where your camera is looking, the quality of the lighting within a joint, you get to see more, and when you see more, you have a tendency to handle situations a lot easier.
Well, in making the decision to use the Stryker system, we asked our own staff, not just the physicians, but our staff, which system they preferred. The staff clearly preferred the Stryker system.
And looking at the DFW area and seeing the type of market share Stryker had, and seeing their product, and seeing with the gains that we could make on a financial, but also much more on the quality side of it, it just made more sense to go with Stryker.
I believe also that one of the things about these new systems with Stryker is the ability to bring in new modules. So as things are coming along in the future, it allows us to move with technology.
We are a technology-oriented hospital. We have a tremendous amount of electronics, and we depend on those electronics, especially with our arthroscopic surgeries, which is the majority of what we do in orthopedics. And by staying in the cutting edge with newer technology and new equipment, it allows us to do more things. It makes surgery a lot easier for a surgeon, and you have a tendency to do more things that you would in the past to make it easier for the patient.
Yesterday I had a physician come into my office and he was talking to me about an endoscopic procedure he does at another facility. He was telling me about how difficult it was to get it done, how it was an older facility, he didn't like the patient's experience. So I started talking to him about the new HD system we had, and we went down and we looked at it, and by the time he left here, he wants to bring all of his patients over here to do surgery.
We have physicians that are the best in their field coming together to practice at a facility that has the best equipment. And I think you would be silly as a patient not to want to go to that type of facility.
The wireless HD platform really is where innovation meets quality. The quality of the product, the quality of the service, but most importantly, the quality of care.